So we're going a little out of order. I'm Kathy Stark, I'm an OBGYN, and I'm going to be talking a little bit today about unplanned pregnancy from a medical perspective. Here we go. But before I begin, let me acknowledge that some of the information I'm going to be presenting today touches on some very difficult and contentious topics. The second part of my talk will contain some medically accurate but potentially disturbing images of pregnancy termination. They're just animations, they're not real live children, but still it may be a little disturbing. So if you have any young people in the room that you want to leave at about halfway point, that would be the time. But I'm a truth teller, I gotta tell you that. I think women deserve the truth about what's happening to their bodies and to the bodies of their children. I've been an OB-GYN for 30 years, and I think one of the worst things is for women to come back to me and say, nobody ever told me the truth about this. It's really hard to get over that. It's hard enough to get over it. If you're educated and you make a good choice at the beginning, but when you're lied to or deceived, it's even harder. So I'm specifically going to show you some facts today without shame or blame. Studies show that 1 in 4 American women will have an abortion in their lifetime. You may have heard that having an abortion is just removing pregnancy tissue or a clump of cells, that it's no big deal. I invite you to listen with an open mind. This may be something that you haven't heard before. It's possible that hearing this may be painful to you. If so, I'm truly sorry. If you are carrying such a burden or someone close to you has a burden from an abortion, I want you to know that you're not alone and healing is possible. Many of our sisters have walked this road before us and are reaching out to help others heal. And I'll be providing some resources on abortion healing at the end here. Great, so let me talk a little about unplanned pregnancy. It's very common. Over half of the babies conceived in our country are unplanned. But that doesn't mean everybody has to have an abortion. But it's interesting because we have this thing called contraception or birth control. People think, I couldn't possibly get pregnant. But 43% of women were using birth control, but inconsistently. And 5% of women who get pregnant were actually using their contraception plan correctly and still got pregnant. So contraception's not a way to always prevent pregnancy. Unplanned pregnancies, they're estimated 3.1 million per year in our country, and 1.3 million end with abortion. But 400,000 end in miscarriage, spontaneous miscarriage, natural event. And 1.4 of those million women will decide to continue their pregnancy. So I know this is just a doctor thing, but I gotta tell you, women on birth control, they think they're taking their pills every day, but when they study them, they say 38% will miss at least one pill in a 3-month period. So the typical failure rate for oral contraceptive use is 7%. It's not 98 or 99 as they say in the perfect use. It's more like 7% failure. And women who rely on their partner to use a condom report 61% of them say it wasn't always used in the last 3 months. So even, that fails too. And women stop their contraception for many reasons, but a big one is the side effects. These hormones do have an effect on our bodies, and not everybody can handle that. So they stop their pills or they stop using whatever method they were using. And the average is 5 months break in between before they start another method. And so a lot of unplanned pregnancies happen in that time. Let's go to the next slide. So these are options for women with unplanned pregnancy. About 15 to 20% will miscarry within the first 12 weeks, and 1 to 2% are ectopic pregnancies. And some will choose to continue parenting the child or placing the child for adoption, as we just heard. And some may choose to end the pregnancy with an abortion. And I'm going to briefly talk about the two main types of abortion. One is a chemical or medical abortion, and one is a surgical or procedural abortion. So as I told you, go ahead to the next slide, please. Words matter. And I think it's important that we tell the truth and we call this what it is. So the terms on the left side of the screen are terms used by the pro-life side of this argument. This is an unborn baby, a preborn child, a human life, or a fetal heartbeat. And the pro-abortion terms, you know, I really liked Pastor Don's statement about Margaret Sanger. He didn't say, but she founded Planned Parenthood.
Yes.
So everything about it is based on deception. So you can look at their websites and you can listen to what they say. Everything is couched in words that are sort of true but not accurate. And they were meant to deceive us. So let's, pay attention when you see that in the media and on the news. They'll call the baby a clump of cells or product of conception. Instead of a fetal heartbeat, they'll call it pulsatile cardiac activity. Yeah. So something with cardiac means heart, and it's doing this, but it's not a fetal heartbeat. So don't get confused. And we would say it's a unique human being, and they'd say, but it's her choice, and it's her right to her own body. So I have a few just comments about terminology. They also say embryo and fetus, though they don't want to say a baby. Well, those are accurate terms of a growing baby in the womb, just as infant, toddler, and adolescent are terms for that same child as they grow into adulthood. We are all the same individual from conception until natural death. And if you are human, no matter your age, your size, your ethnicity, your ability or disability, you are a human being with inherent value and dignity. And our worth is not determined by how big we are, how strong we are, or how independent we are, or how wanted we are. Every single human being is a unique one of a kind, with our own likes and dislikes, personalities, and especially a purpose that was given to us by our Creator. Amen. Next slide, please. Here's some other deceptive words. This doesn't just come from Planned Parenthood. This comes from our academic medical centers and from the government. And here's the Center for Disease Control describing what is an abortion. It's right on the website. The purposeful interruption of an intrauterine pregnancy with the intention other than to produce a live-born infant, which does not result in a live birth. That's a long way to go to say you want a dead baby until people aren't alive, But they don't say it that way. They give you all this gobbledygook. The American College of OB-GYN calls abortion a medical intervention provided to individuals who need to end the medical condition of pregnancy. What? Okay, here's the pro-life OB-GYN group, American Association of Pro-Life OB-GYNs. Abortion is the purposeful killing of the unborn and the termination of a pregnancy. Okay, you know what the truth is.
Amen.
So when are abortions generally performed in pregnancy? Well, 93% are performed in the first trimester, the first 13 weeks. 6% are done between 14 and 20 weeks, and only 1% after 20 weeks. And a fetus is generally considered viable around 23 weeks, although there are survivors born as early as 20 to 21 weeks. So I want to give you some ammunition. I know I'm preaching to the choir here, I can see that. But this is a little video we're going to show next of what life in the womb looks like. And it's really a nice simulation. So we're going to try and play a video, right?
This is Olivia. Though she has yet to greet the outside world, she has already completed an amazing journey. This is the moment that life begins. A new human being has come into existence. At fertilization, her gender, ethnicity, hair color, eye color, and countless traits are already determined. She begins to implant in the uterus about 1 week after fertilization. her cells organize into what we call an embryo. At 3 weeks and 1 day, just 22 days after fertilization, Olivia's heartbeat can be detected. The buds of her arms and legs appear by 4 weeks. She begins to move between 5 and 6 weeks with both spontaneous and reflexive movements. At 6 weeks from fertilization, her brain activity can be recorded and bone formation begins. She can bring her hands together at 7.5 weeks, and separate fingers and toes emerge. She can also begin to hiccup. At the beginning of the 9th week, Olivia will have grown from a single cell into nearly 1 billion cells, and she is now called a fetus. She will suck her thumb and swallow, grasp an object, touch her face, sigh and stretch. At 11 weeks, she is playing in the womb, moving her body and exploring her environment. Her taste bud cells have matured by week 12 but are still scattered throughout her mouth. Her mother will first sense Olivia's movements between 14 and 18 weeks, an event called quickening. Beginning at 18 weeks, ultrasounds show speaking movements in her voice box. Around 20 weeks, with a lot of help, babies have survived outside the womb. At 27 weeks, her eyes are responding to light. She can recognize her parents' voices and will even recognize lullabies and stories. Olivia has gone on an amazing journey during these last 9 months. She will soon signal to her mother that it is time for delivery and greet the outside world.
I'm glad you like that too. I thought it was really a great information, a great way to present this to people.
Yes.
It's a free video, babyolivia.com. You can look it up on
That's excellent.
the internet, and it's a great, yeah, no doubt that's a human. Huh? So I'm just going to reiterate a few of the milestones of a human fetus. But this is coming up as a little baby. You'll see an actual picture of an 8-week fetus. Just to recall, at 22 days from conception, the developing heart begins to beat. At 6 weeks, the embryo is already moving a little bit. At 7 weeks, brain waves are evident. By 8 weeks, the child is either right or left-handed. At 10 weeks, fingerprints are evident. And by 15 weeks, fetuses can feel pain. By 16 weeks, we can detect the child's sex by ultrasound. Yeah, so it's definitely earlier than we ever knew before. We're going to see a little video now of how a first trimester abortion is done, and it'll talk a little about medical and the surgical approach to first trimester abortions.
My name is Dr. Noreen Johnson. I'm a board-certified obstetrician gynecologist with 44 years of experience, and I've completed over 1,000 abortions. Today, I'm going to explain how the abortion pill works, which has been approved by the FDA to be taken up to the 10th week of pregnancy, although many abortion facilities use the pill off-label for weeks after that. The abortion pill regimen consists of 2 steps. Step 1. At the abortion facility or at home, the woman swallows mifepristone pills. Mifepristone blocks the action of a hormone called progesterone. Progesterone is naturally produced in the mother's body to stabilize the lining of the uterus. When mifepristone blocks progesterone, the lining of the mother's uterus breaks down, cutting off oxygen and vital nutrients to the embryo, who then dies inside the mother's womb. It is important to note that even after it has been taken, it is possible to stop the effects of the mifepristone and save the embryo if progesterone is administered. If the woman wants to stop the effects of the mifepristone, she needs progesterone as soon as possible. Step 2. 24 to 48 hours after taking mifepristone, the woman takes misoprostol by placing the pills in her cheeks. She will experience severe cramping, contractions, and heavy bleeding to force the dead embryo out of her uterus. The process can be very intense and painful, and the bleeding contractions can last from a few hours to several days. While she could lose her embryo anytime and anywhere during the process, the woman will often sit on the toilet as she prepares to expel the embryo, which she will then flush. She may even see the expelled embryo within the pregnancy sac. After she has disposed of the embryo, the woman may have bleeding and spotting for several weeks. Bleeding lasts on average 9 to 16 days. 8% of women bleed more than 30 days, and 0.5% require hospitalization because of heavy bleeding. The failure rate increases as the pregnancy progresses. At 8 weeks or less, the failure rate is 2 to 6%. At 8 or 9 weeks, the failure rate is 4 to 6%. At 9 to 10 weeks, the failure rate is 7 to 9%. At 10 to 11 weeks, the failure rate is 13%. If failure occurs, she will usually be offered a surgical abortion in which the embryo or remaining tissue is removed using suction. For the mother, abortion pills often cause abdominal pain, nausea, vomiting, diarrhea, headache, and heavy bleeding. Maternal deaths have occurred, most frequently due to infection and undiagnosed ectopic pregnancy. Ectopic pregnancy is when implantation occurs outside the uterus, usually in the fallopian tube. As I mentioned in the beginning, I used to perform abortions. At the time, I truly believed I was helping women. I initially stopped doing abortions to save my reputation. I was becoming known as a town abortionist, and I didn't want that. Later, however, I came to recognize the inherent value and dignity of all human life. That's when I truly saw the ugliness of abortion. Now I am a pro-life advocate. I am proof that anyone can change, no matter who they are or what they have done. I invite you to join me and make a decision to protect the preborn. Thank you.
Okay, she no longer performs abortions. I'm not going to finish. I got to save some time here, but yes, Noreen Johnson, and that video is also available online. Gosh, it's hard to see that, and that's an early abortion. I will just briefly mention about ectopic pregnancies because this is in the news about that's how they sold us this abortion amendment here in Michigan. And they're doing it all across the country. There's 10 states this year who have a similar abortion amendment on their ballot. And they're saying to women that if you don't approve abortion for all 9 months of pregnancy, women will die of ectopic pregnancy because they won't be able to get care. Well, ectopic pregnancy, where the pregnancy is outside the uterus, is a life-threatening condition to the mother, and it must be treated to save her life. Your choice is, lose them both or save the mother, and the baby can't survive even if, it stayed outside the womb. We have no technology to transplant that baby from the outside of the womb to in the womb. We don't have that technology yet. So doing a treatment for ectopic pregnancy is not an abortion, and you don't need to have legal abortion in order to treat ectopic pregnancy. We never did, even before Roe versus Wade 50 years ago. We didn't have any problem treating ectopic pregnancy. So that's another falsehood I just wanted to point out. Okay, great. So we've covered first trimester medical abortions. So I wanted just to, for those of you who may know someone who's doing this, how do you know when you're having a complication from a first trimester abortion? This is important information because you're not always told this at the abortion clinic, or if you buy your pills online, you won't be told how do I know I'm having a problem? Because heavy bleeding is part of this process. So when is heavy bleeding too much bleeding? Well, we prefer women use sanitary pads, not tampons, when they're bleeding from a miscarriage or even after a birth. So we can measure how much. So if a woman is soaking a large pad, greater than 1 pad per hour for 2 hours in a row, that's too much bleeding. She should go get evaluated at the hospital. If she's feeling dizzy, lightheaded, or fainting, she needs to go to the hospital. Infection is a really serious complication. This is in the news this week about some cases in Georgia. One woman died after a medical abortion from infection, from an overwhelming sepsis. It was not the fault of the abortion law. The fault was the medical abortion. This is a known complication, that it's not a completed abortion, and she had dead tissue left inside of her which got infected, which caused an overwhelming infection, and women can die. So watch for signs of infection: a fever greater than 100.4 degrees, abdominal pain, or tenderness. If you have persistent vomiting or diarrhea for more than 12 hours, or if you're feeling dehydrated, go get help. And if you have a foul smell foul smelling discharge, it's also a sign of a bad infection. You should go get help. Okay. A nice little picture of a baby. There's nothing to say other than that's a little baby at 20 weeks. So our technology is really great because now we can see babies in the womb. Are you able to run that, Karen? This is a little moving picture. Oh yeah, there's the, yeah, do that. And then we'll see this little guy in the womb. Our MRIs are so great now that we can watch babies in the womb. And we use MRI, it's safe in pregnancy, to help determine some side effects. Imagine what the mom's feeling there. Yes. Yeah, we could feel her. You know what's really cool is we're doing fetal surgeries now in utero. So they make a little incision in the mom's belly, and they can actually go in and fix birth defects before birth. So we save lives of these fetuses, and we can correct a spina bifida or opening in the back so that they can walk and they won't be disabled when they're born. We can fix that before birth now. So definitely a human baby, you know, no question. So we're going to get into some harder stuff here. This is later term, the second trimester abortions. These occur between 14 and 23 weeks. The most common method of doing an abortion at this time is something called a D&E, or a dilation and evacuation. Because the baby's a little bigger now, we have to prepare the cervix so we can stretch the cervix open. That usually is done a day or two before the actual surgery because the fetus is too large to be removed intact. This has an increased risk compared to the earlier abortions. As you can imagine, there's more blood, there's more tissue, higher risk for injury to the uterine muscle, and a laceration of the cervix. It could do some trauma to the cervix. It's more painful for women. It requires anesthesia for the mother, but the fetus can also feel pain, so they don't anesthetize the baby when they do these procedures. But, you know, that's another thing. And bleeding may last at least 2 weeks after this procedure. And then in the second half of the second trimester, they're called late second trimester abortions, especially if the abortion is elective. Their goal is to make sure that the fetus is dead before it's fully delivered. And there is no possibility for the mom to see or hold her baby intact after these procedures. So sometimes, I just got to say this, because this is another way they sold that abortion amendment, was that women needed to have abortions because they get medical complications of pregnancy. They could have an infection, or their water might have broken early, or they may have high blood pressure, preeclampsia, and they need to be separated from the baby to save her life. And there are situations where I've run into that a lot in 30 years. Doesn't mean I have to kill the baby before I deliver the baby. There's no medical benefit to the woman for that baby to be dead when it's delivered than to deliver it alive and give her a chance to hold her child and bond with her child and comfort that child until it does die a natural death. We don't have to be aggressive and go in and kill it first. It's not a medical indication for that. And women just aren't really told that. You know, it's really sad. So If we want to go on, I think there's a video, yeah. Let's do that next.
What are your thoughts about abortion?
I think that the women should have the right to choose what they do with their bodies.
I have to second that 110%.
I'm pro-abortion. People should have the choice if they're not ready.
Would you both support abortion all the way up to the moment of birth?
Oh yeah, I do, yes.
I have nothing against it, and I think, it's a right and a choice for people to exercise it.
I personally wouldn't do it, but I wouldn't restrict anyone.
Pro-choice, for sure.
In one word, can you describe your thoughts on what you saw?
Disturbing.
Barbaric. Yeah.
It's a form of just taking life and just throw it in the trash. That's too much for me. I have children.
No, I don't think any kid, any baby, any infant, any fetus should go through that. No.
That's not okay. That's not okay. That changes my opinion.
The videos that you guys showed me has changed my mind.
Seeing that was really sad.
My name is Dr. Anthony Levatino. I'm a practicing obstetrician gynecologist, and I've performed over 1,200 abortions. Today I'm going to describe a second trimester surgical abortion called dilatation and evacuation, or D&E. A D&E is performed between 13 and 24 weeks of pregnancy. After administering anesthesia, the abortionist uses a weighted speculum, like this one, that opens the vagina widely. Because second trimester babies are so large, this greater access facilitates a late-term abortion. Late-term abortion requires that the cervix be prepared 24 to 48 hours in advance with laminaria. Laminaria is a type of sterilized seaweed that absorbs water over 8 to 12 hours and swells to several times its original diameter. Once removed, metal dilators can be used to further open the cervix as needed. Once the cervix has been stretched open, the suction tube is placed inside. A baby at 20 weeks gestation is as big as the length of my hand, from head to rump, not counting the legs. The suction machine is turned on, and pale yellow amniotic fluid surrounding the baby is suctioned out through the catheters. With babies this big, they don't fit through catheters this size. The baby's bones and skull are too strong to be torn apart by suction alone. This is a Sofer clamp. A Sofer clamp is made of stainless steel. It's about 13 inches long. The business end is about 2.5 inches long and a 1/2 inch wide, and there are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. The abortionist uses this clamp to grasp an arm or leg. Once he has a firm grip, the abortionist pulls hard in order to tear the limb from the baby's body. One by one, the rest of the limbs are removed, along with the intestines, the spine, and the heart and lungs. Usually the most difficult part of the procedure is extracting the baby's head, which is about the size of a large plum at 20 weeks. The head is grasped and crushed. The abortionist knows he has crushed the skull when a white substance comes out of the cervix. This was the baby's brains. The abortionist then removes skull pieces. He removes the placenta and any leftover parts of the baby with a curette, scraping the lining of the uterus for any remaining tissue. The abortionist then collects the baby parts and reassembles them to make sure that there are 2 arms, 2 legs, and all the pieces. Once all the parts have been accounted for, the abortion is complete. For the woman, this procedure carries a significant risk of major complications, including perforation or laceration of the uterus or cervix, with possible damage to the bowel, bladder, and other maternal organs. Infection and hemorrhage can also occur, which can even lead to death. Future pregnancies are also at greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levatino, and in the early part of my career as an OBGYN, I performed over 1,200 abortions. One day, after completing one of those abortions, I looked at the remains of a preborn child whose life I had ended, and all I could see was someone's son or daughter. I came to realize that killing a baby at any stage of pregnancy for any reason is wrong. I want you to know today, no matter where you're at or what you've done, you can change. Make a decision today to protect the preborn. Thank you for your time.
Okay, I'm sorry, that's hard to watch.
It's so necessary.
It's harder to see.
It is.
So I was a OBGYN for 30 years. I worked at Troy Beaumont. One day I was covering the ER for any cases that would come in, and a woman came in by ambulance from an abortion center nearby. And she had been undergoing an abortion just like that. But she was hemorrhaging, and they couldn't stop the bleeding, so they put her in an ambulance and sent her to the hospital. And I was one of the surgeons on the team that took her to the operating room to try to stop her bleeding. We opened her belly and we looked inside, and there was a big hole in the uterus where the big clamp had pushed right through they were trying to find the head, they couldn't find the head.
Oh my God.
They had made a hole in the wall of the uterus, and the head had moved out, and some other parts. So it took a team of surgeons to clean out her belly, irrigate, stop her bleeding, sew up her uterus, and a young woman, 20 years old. And she said to me after she woke up in the ICU, "What happened?" And I told her. And she said, "I didn't know that could happen." Well, so it's hard for me to tell you this, but this is important.
Yes.
That young women know.
Yes.
This could happen. This could affect your fertility down the road.
Yes.
And this is a human, believe me, holding that baby's head was not something I wish for anyone. It is very, very, very difficult to do. So how can these, we say, how can these doctors do that? What is it about the doctors that let them be so barbaric? And I'm telling you, I know who the enemy is. And number one, he's a big deceiver. He's a liar. He's an accuser, and he deceives us. So these doctors think they're doing a good thing by helping this woman, and they have blinders on their eyes. But eventually, even this Dr. Levatino, he sounds really harsh here, but he will go on to talk later in the video about what happened to convert him. The Holy Spirit is working. So we need to pray for these people who are blinded, who think they're doing good things for women, but they're really harming themselves, they're harming children, and they're harming women. So thank you for letting me share that. I appreciate it. Okay, next slide, please. I've been giving you all the bad news. Let me give you some good news. So we have a whole bunch of people in this room, and I'm among them, that we work for pregnancy help centers or pregnancy resource centers, trying to help women make a different choice, give them options, a real choice, because right now women choose abortion because they say, I have no choice, I have to do this. But these are some of the things that pregnancy resource centers will do. They'll listen first to her concerns. We treat her with respect. We confirm her pregnancy. We show her the baby with ultrasound. We make sure she didn't have a miscarriage or an ectopic before she has to make a decision about abortion. Because she may not even need to make any kind of decision. It might be already done. We talk about options. We give her complete, medically accurate information, and along with emotional and spiritual support. We provide material resources if that's what she needs, or refer her to community support agencies. And we walk with her throughout the pregnancy and delivery. We offer parenting classes, prenatal care in some centers, my center does, and post-abortion recovery and support. It's important you know these are all community-based organizations. They're nonprofit, they're charitable organizations. There's over 100 centers in Michigan, 16 in the Detroit metro area. We walk with women through this challenge, and we stick with them for even up to 2 years after they deliver. Across the United States, there are more than 2,700 pro-life centers. Next slide. And this is what we offer at Crossroads. I kind of went through a lot of that. It's also important to know, there is also a concerted effort in the media and with some politicians to malign pregnancy health centers. They call us fake clinics. They say, oh, you're doing medical care, but you don't have any medical people there. You just, pretend or pretend. Because we don't do abortion, and that's true, we don't do abortion, but we do offer all the alternatives to women. And in all the centers here in Michigan, medical services are only provided with licensed medical professionals under the direction of a physician. Okay. Post-abortion healing, if a woman has chosen to end the life of her child for any reason, she still experiences a deep sense of loss, but often she denies herself the chance to grieve. Her loss is not acknowledged. She may use denial and repression as defense mechanisms to cope. She may get angry. She may shout her abortion on TV, she's so happy she did this, but she's deeply wounded. She still has a loss. Despite what the culture telling her it's no big deal, in her heart, she knows something's wrong. Yes. She's probably feeling alone and silent and doesn't want to talk to anyone about it. And studies show that mental health problems are 80% more common in women who've had abortions, and it's no wonder with all that suppressed grief. Suicide rates are 4 times higher in women who've had abortions than the baseline, and anxiety and depression are increased by 30 to 40%. So there are organizations and websites. My center is one too. We have a post-abortion recovery. It's been very helpful for the women who've chosen to reach out and seek help. And these are some websites and actual resources if you want some information about post-abortion recovery. For the church, the Abortion Wounded Church by Karen Ellison is a great book. It talks about our challenges, just what you were talking about, Pastor, how we need to get our churches involved in solving this problem. But there's so much hope for redemption and healing. Our God is bigger than any of this. So, thank you. And I'll be in the back. I have a table in the back if you have any questions afterwards. But thank you so much.